Hello, viewers, and welcome to another episode of our health series here in End Time Hope Channel. For some time now, we've not been able to reach out to you with some very interesting and educative series. Due to some certain challenges, we apologize to that. Today, by the grace of God, we have with us here a very wonderful person who has been able to make it to the studio today to discuss a very important topic, a topic that is of interest to both the youth and also adults. With us right here today to discuss on the topic of hypertension is a medical doctor with the Federal Medical Center Asaba by name Dr. Njomo Samuel. Sir, please, can you kindly greet our viewers?
Okay. Thank you very much for having me. It's a pleasure to be here.
The topic of hypertension has been one of global concern. Looking at statistics, we see a very high rate of hypertension, and it has been noted to be one of the most killer ailments. By implication, both adults and youth suffer hypertension. Doc, would you kindly explain to us what hypertension is, please?
Okay. Thank you once again for having me. You know, when we talk of hypertension, another word to use can say high blood pressure.
Okay.
That's another way to put it. And it simply means the pressure with which blood moves in the body. You know, we can liken the body to a system where there are many vessels. The body has many blood vessels, and blood is always moving. And these blood vessels can be likened to a pipe, a hose that water passes through.
True.
And you know, depending on the size of the pipe, the more narrow it gets, the more the blood flows at a higher pressure. You understand? And this high pressure can then lead to other problems.
Wow.
So that's basically it, the pressure with which blood flows through vessels.
All right. Thank you, sir, for that. But when we talk about the pressure through which blood flows, does it mean that the blood is supposed to move at a certain pressure? And if that is the reason, why then do we have hypertension? What causes it?
Okay. Thank you very much. You see, the normal pressure that blood is supposed to move at is, we have what we call a systolic and diastolic. Well, let me not bore our viewers with all those names, you know. And the values are just 120/80.
Okay.
That's the normal blood pressure, 120/80. So less than that, that's the normal. It varies for individuals. And then when we start seeing blood pressures around 120 to 129 and then less than 80, we say it's elevated. Then when we start seeing 130 to 139, we say we have stage 1 hypertension. Then 139, 140, 80 to 90, you know, you are now in stage 2 hypertension. You know, so basically anything greater than 120. Yes.
Okay, that's what we could consider as
Hypertension.
Okay, now thank you for that exposition. Would you kindly help us with what causes it? Is it our diet? Is it our lifestyle? What are the causes of hypertension, sir?
Thank you very much. You know, in medicine, we like to refer to them as risk factors.
Okay.
Things that may predispose one to having hypertension. And the things can be divided into modifiable and non-modifiable. In other words, there are things that we can change and there are things that we cannot change. Let me start with those that we cannot change, those that we can't do anything about. Number one is age.
Okay.
Hypertension is commoner in elderly. We all get old, so there's nothing we can do about that.
I'm afraid we get old.
There's nothing we can do about that. No, it's commoner in the elderly. You know, as you grow older, the same vessels, blood has been flowing. So some of these things is commoner in the elder. The next one is sex is commoner in males compared to women. So that means men at higher risk of hypertension. Then another thing is it can also be hereditary. Meaning, if my father is hypertensive, there's also a chance of me becoming hypertensive. You understand? So there's nothing I can do about
About
that.
it, yeah.
Then the last one that nothing can be done about is race. Hypertension is commoner in blacks. So these are the ones we can't do anything about. Then there are those ones that we can do things about. Number one, risk factor, obesity.
Okay.
Being overweight, that is one that can be modified. So someone who is overweight is at risk of hypertension. Someone who takes a lot of alcohol, is also at risk of hypertension. Then also someone who smokers, they are also at risk of hypertension. And a sedentary lifestyle. By sedentary lifestyle, we mean someone who maybe it doesn't move about a lot. Probably day to day, you're just in one position. There's little amount of physical activity. It can also predispose. Then also stress. Stress can also predispose one to hypertension.
Okay. Thank you so much for exploring the causes, which you mentioned as including modifiable and non-modifiable. But now you mentioned the fact that when one is living a sedentary lifestyle, which basically means staying all at home and not moving or in the office or all that. And also you mentioned that stress is also a risk factor. How do we balance this concept of moving around also, and also stress being a risk factor to hypertension?
I get. Well, in terms of moving around, there are some jobs that require people to sit in one spot
Yes.
all day.
Yes.
They are sitting in one spot day to day, and even when they get home, they are in one spot. So the simple cure for that would be to find time to exercise.
Okay.
Okay. Or even while at work, to find a way to bring in some level of, instead of sitting at one spot, moving, finding a way to move.
Okay.
Or preferably, you just find time to exercise. While on the part of stress, well, I get where you are coming from. We want you to move, but we don't want you to move too much.
Yes, of course.
You understand?
Yes, sir.
True. So the problem with stress is that, when we are stressed, the body releases a lot of stress hormones, which can also predispose us to a whole lot of other challenges. So that's why there must be a balance. There must be a balance. While we must work, there must be a balance so that we don't go beyond.
All right, thank you. So basically, there should be time for exercise for ones who are who are disposed to working in a sedentary environment, and also there should be time for rest for people who work in. Thank you so much for that explanation. For someone who have hypertension, it would be very important we know what could be the symptoms.
Okay. Hypertension is known as a silent killer. It has to be said because it is possible for someone to have hypertension and for a long period of time he won't feel anything. So I've been in the hospital, we come, we check people's blood pressure is high, and we are like, oh, your blood pressure is high. I say, doctor, I'm not feeling anything. You understand? For most people, they will not feel anything until there is now a problem. So it can be there and there may not be any sign until probably too late. And that's why it's important for us not to wait to see the sign.
Okay.
That's why we encourage regular check of the blood pressure rather than to wait for the sign. But what are some of the things that we may see in those that are hypertensive? And some of these signs, it will take years. The person may have had it for years before you will see some of them. Earlier we mentioned that there are blood vessels all over the body. from head to toe. So by implication of that, hypertension can affect us from our head to our toe. Anywhere that there's blood vessel, anywhere blood goes to, hypertension can affect it. So some of the signs we see, we have things like headache, dizziness. Then when we come to the eyes, we can have blurring of vision. Then we can also have nausea, vomiting. Then we can also have things like chest pain, difficulty in breathing. Then we can also have swelling of the leg, what we call pedal edema. And we did mention it earlier, there are some secondary causes of hypertension. There are some organs that, when affected, they can cause hypertension.
Okay.
And similarly, hypertension can also cause damage to those same organs in the body.
Interesting.
So it can work both ways. Yes.
Okay. All right. Thank you, Doc, for outlining the symptoms for us. So now I've learned some interesting topics, and also have learned the fact that there are secondary causes of hypertension as well, where organs are affected, and then those ones will now trigger some other challenges as well. Now, since we have understood that these symptoms seems to even be everyday life experiences, what do you suggest should be our precautionary measures to this regard, sir?
Thank you very much. The preventive measures, I would say they are simple, and at the same time they are difficult. Let me put it that way. Because hearing them, they seem like very simple things. Number one being weight reduction.
Okay.
For someone who is overweight or who is obese,
Okay.
all he has to do is to reduce his weight, because at that point you're at risk of hypertension. And weight reduction is not as easy as it sounds.
Yes.
There's a lot that is involved in reducing weight, and they usually need a lot of support to help them, get through that phase. But for those who are noticing that their weight is on the increase, they also need to be careful to do those things that will help to reduce the weight. Another is what we call the DASH diet.
Okay.
It's a diet that is rich in vegetables, grains, and fruits. We have to be willing to switch up our diet to include more vegetables, fruits, and grains. Foods that are high in grains, we need to take more of those foods, as against foods that are fatty. We need to reduce fat and oils, the amount of fried things we eat, the amount of fatty things we eat. We need to tone it down a little bit. And also, a very important one, we need to also reduce the amount of salt intake. Intake. There are those who use table salt. When the food has been prepared and the food is served, you still you still sprinkle some salt, because you think you're not getting the taste.
Yes.
Salt is one of the major triggers for hypertension, and part of managing it is that the salt intake must reduce. And not only that, of adding salt on the table, that must be completely off. Even while cooking, it must be done moderately. So salt intake is very key. Then also, for those who drink or those who smoke, you must cut down. I said some of these things are easy to say, but if you are talking to a man who has been smoking for years or who has been drinking for years, so there's a lot of work that needs to be done, a lot of support that needs to be given to these individuals so that they can gradually, reduce alcohol and, stop the smoking, and also exercise. It cannot be overemphasized. And when we mention exercise, a lot of people like to think that want them to run 1,000 kilometers. No, that's not what we are saying. We
Okay.
are saying, it should be a gradual process, a little, a little. We are more interested in consistency than volume. In
Okay.
fact, we are more interested in jogging for 10-15 minutes every day,
Than
than
jogging one
jogging 2 hours
hours.
in 1 month.
Okay.
So it should be a consistent thing over a period of time, and you will discover that the more you do it, the easier it gets to do it. So everyone should exercise, and the last but not the least, like we mentioned earlier, stress management, and you have to manage. I know life and challenges and all,
So
but
those
there
stress.
needs to be a balance between um our work and how much we take care of ourselves. And most of the times, for those who are what we call pre-hypertension, with only lifestyle modifications, even without medications, they are able to have a normal blood pressure
Interesting. Wow.
just with lifestyle
Modification.
modifications. Those that are the level of pre-hypertension. Then they are just by modifying the way they do some of all these things I've mentioned, they are able to reverse the trend. And these things are actually very important for those who have fathers, mothers who have a history of hypertension, because they're already at risk. It's already in their blood. So they need to do more to ensure that they protect themselves from
Against.
hypertension.
Okay. Thank you, sir. Right now, I've learned so many ways we can actually protect ourselves or take precaution against hypertension. But I find something very concerning. When we look at the population description you have mentioned, you mentioned that it's more on the adults than the youths. Does it mean that the youths do not really have a role to play in trying to prevent this before time? Because we see a situation where most youths are caught up in the web of doing life than actually taking care of their health or actually being interested in some of these concepts or topics. So, do the youths have any role to play in this regard?
Yes, thank you very much. It's very important the point you mentioned. Before now, hypertension used to be mainly elderly.
Okay.
Before now, but with over time, with the change in lifestyle, the kind of things we eat, there's an increased amount of processed foods
Foods. Okay. Circulation.
in circulation. Is becoming more popular, it's becoming more common.
Yes.
So what we are seeing is that even younger people are becoming as affected as even the elderly,
Oh,
you know,
okay.
because of these things.
Yes.
So it comes down to, the lifestyle. And that's why it is important, even as young people, to be cautious of what we eat, because those are some of the things that will also predispose us to it. So also, a lot of abuse of medications, drugs, and all that ongoing now. So all of that are things that are now predisposing young people to having hypertension. And also the secondary form of hypertension, it's seen more in younger people because there's a cause for it. You understand? Against the primary, which is there's no cause for it per se.
All right. Thank you, Doc, for availing us of your time
Yes.
to discuss this very important topic. Thank you, Doc, for coming to the studio today. We appreciate your time and efforts. And to our dearest viewers, thank you for sticking by us. To a very large extent, we've been able to discuss the topic of hypertension. Now we understand that there are actually some secondary and primary causes. There are some modifiable and non-modifiable causes as well. There are some symptoms which spans everyday activities. And part of the ways we can actually take precautions against hypertension would include lifestyle changes, which would include taking our diet seriously, taking more like the DASH diet principle, and also stopping sedentary lifestyles and some of these things that Doc have mentioned today. I am very sure that you have been able to learn a lot today. It is very important you take your health very seriously. And should you have any concern, you can always see the doctor nearest to you. Doc, please, can we have your last words as your advice to our viewers on this issue of hypertension?
Okay, hypertension is a very common ailment,
Okay.
and it's a chronic ailment. I forgot to mention earlier. When someone is hypertensive, because there's some misconception. Hypertension is one of those ailments that when you are hypertensive, you are hypertensive.
Okay, cure.
There's no cure for hypertension. It's
Wow.
one of those things that are not treated but managed.
Okay.
It's
Wow.
managed.
Wow.
A combination of both lifestyle changes, lifestyle modifications, and when necessary, drugs. So when you have hypertension, the management is easy. Let me put it that way. It's not a death sentence. It's something that can easily be managed. If you notice any of these things, you go to your nearest hospital, be checked, and you see a doctor. And if he is convinced that this is hypertension, you will be started on medications. And in addition, with the lifestyle changes we have mentioned, I'm sure it will be fine.
Thank you, Dr. Samuel, for your time. Our viewers, you need to start taking charge of your health. If you have not been tested recently, go for a medical checkup. Ensure that you take care of yourself very well. And by the grace of God, we are very positive that even if you have hypertension, it can also be managed. Thank you for sticking with us. I remain your host, Chibwike Samuel. We are going to be leaving this at this point. See you next time. Thank you.